Welcome back to West Texas View.
Before the break, we were talking with Dr. Bobby Jain about the need for psychiatrists. Tell me how many psychiatrists we have that serves the whole Permian Basin. Do you think there's 10 or 7 or?
They're definitely very limited, I would say. Many of my colleagues are cutting down their hours. Many of them are actually, 2 of them I know are reducing the number of hours they're seeing patients.
As they're getting closer to retirement.
Yes, exactly. And we are not replenishing any new blood, so as to speak, new talent, new qualified, fresh, enthusiastic people, psychiatrists, to replace the growing need. So the influx of population, as we see here, is completely outpacing the needs for the psychiatric care.
And diagnosing these earlier and earlier puts even more strain.
Yeah.
And so that makes the probability of getting the internship program even more urgent.
Right.
And so, because that way you'd be training and having
homegrown psychiatrists who are more willing to stay in this area. You bring up 2 important points. One is the need to train our own folks, train new medical students to become psychiatrists. That means starting a psychiatry residency program. And the other important thing that you brought it up is to have early intervention. So just like a bone, if the bone is broken and it's not given adequate time and adequate attention to heal, it may not set, it may continue to be painful, it may be disfigured, or it may not be healed adequately, and maybe your limb may never be used as well as you ever were able to use before it got hurt. The same principle applies to mental health. The earlier you detect, the earlier you intervene in any emotional problem, and even a small help can be immensely fruitful in addressing a very big calamity. And I can tell you some of the statistics we just talked about in the study. Throughout the world, there are about close to 800,000 to 1 million people trying to harm themselves because they have emotional problems. In America particularly, we have close to, and maybe other parts of the world also, we have 1 suicide attempt every 42nd.
Oh my goodness.
That's a staggering number of people.
It is.
And these are the people who are really find their backs to the wall, and they find no other way out but to kill themselves. Can you imagine how many people are suffering, struggling, not able to cope with situations,
and don't know where to turn.
I don't know what to turn, and they may not realize that they may be going through an emotional problem themselves, and hence not able to detect it, not able to get cure. And so the need, I mean, what we are seeing in these figures is just tip of the iceberg, where the whole iceberg is huge, and the prevalence of mental illness in our society is maybe multiple folds. Number of psychiatrists we have in this area, as you were mentioning, it's I would say we have about 6 or 7 of them which are actively practicing. I'm not counting the ones who don't take Medicare or Medicaid. In fact, I can say that Texas Tech and my practice is the only one that takes Medicaid patients. Very few take Medicare. So either you should be having a private insurance, commercial insurance, or fee for services, pay cash. And that's what has come out to be, which is, I think, is very unfair. But that's how it is, a supply and demand thing.
Which is one more reason why you're so busy.
Well, it's one of the reasons that, to be put accurately, I'm not able to meet the demand of the people folks that need adequate psychiatric care. My responsibilities are not only treating patients, my responsibility is also towards teaching medical students in the science and art of psychiatry, treating psychiatric patients, because medical students are required as one of the core curriculum, at least 8 weeks of psychiatry exposure, be it inpatient, outpatient, combination of these 2 things are very much required for these folks to do that.
Because every doctor, regardless of what their specialty is, should be able to have the rudimentary ability to
Yes.
see that
See and
a
understand.
person has needs to be
Right,
referred
right,
to someone else.
Right.
That
No matter what specialty they practice in, that's the whole philosophy of medical education is, no matter what specialty the medical students choose to specialize in, they should have some ingrained knowledge of understanding, treating psychiatric illnesses. Though agreed, 8 weeks is a very short period, because most psychiatrists take 4 years of their lives to learn to be certified as a full-time practicing competent psychiatrist. And the second point that you're mentioning is that because we have so much difficulty in attracting and recruiting psychiatrists, the Texas Tech Health Science Center in Permian Basin and myself and the dean, we have decided to initiate a psychiatry residency program. Our biggest hurdle has been recruiting and having adequate number of faculties, trained psychiatrists who in turn will train the teaching psychiatrists.
Yeah.
So we are planning to, we're planning to get community psychiatrists involved. We're planning to get mental health mental retardation or MHMR clinics involved to get some form of learning experience. But I want your viewers to galvanize the support that we need from the bottom up. Be aware that we need resources, we need funds,
the funding comes from the Texas legislature.
And Texas legislature. So I would strongly encourage each one of you to contact your representative, your legislator, your congressman, everything, and raise your voice about pushing this program and providing us with all kind of supports, not only just financial but also logistic support that we can need to get this program going.
Well, and when you stop and think about some of the really sad things that have happened, whether it's a suicide or the people that are attacking other people because they're mentally untreated, it makes it even more urgent. We're going to have to take a break right now, but we'll be back in just a minute and continue this conversation. See you in just a minute.
Stay tuned. West Texas View will be right back.